This video will discuss the role environmental pollutants have in causing the symptoms and biochemical abnormalities found in those diagnosed with autism spectrum disorder. I will show you how detoxification of these pollutants can improve the symptoms and markers or potentially reverse the diagnosis. We will demonstrate to you that in the scientific literature there is an overabundance of proof that exposure to environmental pollutants cause or contribute to the disordered biochemical markers consistently found in those diagnosed with autism spectrum disorder. We will show to you that when levels of these pollutants are lowered in those with autism spectrum disorder, the biochemical markers improve, as do the behavioral symptoms, physical symptoms, and cognitive impairments. While there are various subtypes of autism spectrum disorder, some which are less likely to be associated with exposure to environmental pollutants, the research, as you will soon see, shows us that a large portion of patients drastically improve with treatments aimed at lowering the toxic burden commonly present and addressing the biochemical abnormalities that exposure to these pollutants cause. This video will inform you of the treatments which the scientific literature has shown to be beneficial. A study conducted in the USA on 55 children diagnosed with autism and 44 healthy controls found significantly higher blood lead levels along with increased urinary lead, thallium, tin, nickel, and tungsten levels. This research shows us that a diagnosis of autism spectrum disorder is associated with increased exposure to environmental pollutants or perhaps a reduced capacity to detoxify these pollutants. A study of 30 children diagnosed with autism and 30 healthy controls conducted in Saudi Arabia found the children diagnosed with autism spectrum disorder had elevated markers of oxidative tissue breakdown, depleted levels of vitamin E and vitamin C. Both are important antioxidants. The research found increased activity of two antioxidant neutralizing enzymes. These markers, coincidentally, can also be used as an indirect way to detect prior or ongoing exposure to environmental pollutants or a high body store of these pollutants. It is very hard to determine direct tissue levels of environmental pollutants, so an indirect way to detect them is by looking at the biological changes they cause, one of which is depletion of antioxidant levels, which is consistently seen in those suffering autism spectrum disorder. A study from the UK looking at the brain tissue of 5 deceased patients who had a diagnosis of autism spectrum disorder found some of the highest brain aluminium levels ever recorded. While this study only had a limited number of subjects, it is important because there is very little research on tissue levels of pollutants in those diagnosed with autism. So in this study and the 2 previous studies, we can see that an autism spectrum disorder diagnosis is associated with increased levels of toxic metals in the tissues, blood, and urine. We also see changes in indirect biomarkers that occur during and after exposure to environmental pollutants. A study on 30 autistic children in Egypt found that supplementation with vitamin E, C, and zinc substantially improved markers of oxidative stress in the children, increased levels of antioxidants in the blood, and substantially improved the children's symptoms as measured by the Childhood Autism Rating Scale. After 3 months of supplementation, the levels of aluminium in the hair were decreased by more than 50%. At the start of the study, 40% of the patients were classified as severe, and at the end of the study, there were no patients classified as severe. An important study was conducted in the USA on 33 healthy controls and 20 children diagnosed with autism. The study found that autistic patients had significantly lower levels of total glutathione, which is a critical cellular antioxidant, increased levels of oxidized or used up glutathione, and abnormal levels of a number of amino acids in the blood. Supplementation with folate, biotin, and vitamin B12 dramatically improved the abnormal levels of glutathione, oxidized glutathione, and amino acids in the blood to the extent some of them were no longer statistically different to healthy controls. While behavior was not formally assessed, it was observed that there were improvements in cognition in the subjects. As you will later see, exposure to environmental pollutants cause these same biochemical abnormalities. Those who do have an autism spectrum disorder diagnosis should strongly consider taking these 3 widely available supplements. We will talk about specific doses used in a moment. A placebo-controlled trial from the USA, which included 141 subjects diagnosed with autism plus 44 healthy controls treated with a specifically formulated multivitamin multi-mineral for 3 months, found that overall scores related to behavior, sleep, and cognition showed improvement. Some markers of behavior and language significantly improved. Plasma levels of multiple vitamins, minerals, antioxidants, and markers of oxidative stress were significantly improved to levels not significantly different to healthy controls. While the body is suffering increased ongoing oxidative stress, there is an increased need for vitamins and antioxidants. Those with a diagnosis of autism spectrum disorder should be supplemented with an appropriate multivitamin multimineral. In a study conducted in the USA on 61 children that were given a pharmaceutical metal chelating drug to remove toxic metals from their body, found that just one treatment resulted in a dramatic normalization of red blood cell glutathione levels, which are repeatedly shown to be abnormal in patients diagnosed with autism. Levels of lead excreted in the urine increased tenfold, and this tenfold increase persisted in the majority even after undergoing multiple rounds of this treatment. While the levels of urinary lead did increase tenfold, the amount excreted could be considered to be in the normal range. As there were no healthy controls used in this study, it is hard to determine how significant this increased excretion of lead is. However, the normalization of red blood cell glutathione levels indicate that this kind of treatment is beneficial for those who are diagnosed with autism spectrum disorder. In part 2 of this study, measures of cognition and behavior were compared, and it was found that significant benefits were made in the children's behavior, sociability, cognition, and physical health after 7 rounds of treatment with the metal chelator DMSA. Measures of autism severity were improved when analyzed using a number of different benchmarks. Again, here we see when the biochemical abnormalities are addressed, in this case by detoxification, the behavioral and cognitive symptoms associated with autism also improve. We will discuss this treatment in more detail in a moment. A study of 44 children diagnosed with autism spectrum disorder was conducted in Egypt. Similar to the previous study, the subjects were administered the same metal chelating drug called DMSA. The administration of DMSA substantially increased the urinary excretion of cadmium, lead, and mercury. The subjects were treated once a month for 6 months. After that time, they were again evaluated using the Childhood Autism Rating Scale, and it was found that there was a substantial improvement in their CARS score from 38 to 33. As we can see again, depletion of environmental pollutants from those diagnosed with autism spectrum disorder improves the symptoms associated with the diagnosis. One more study conducted in the USA using a similar procedure as the previous 2 studies compared 55 children diagnosed with autism to 8 healthy controls and found, upon DMSA administration, children diagnosed with autism spectrum disorder excreted much higher levels of mercury than the healthy controls. Again, we can see a strong association with environmental pollutants and a diagnosis of autism spectrum disorder. In a small study conducted in the USA on 10 patients diagnosed with both autism spectrum disorder and ADHD were treated with an organic diet, herbs to support gastrointestinal system, antigen allergy therapy, antioxidants, vitamins, toxin exposure avoidance, and heavy metal chelation therapy, found that after 3 to 6 months, levels of all measured toxic metals in the urine decreased, and there was a significant decrease in urinary lead. Almost all patients reported improvements in physical health, concentration, behavior, social interaction, and digestion. While the patients in this subject were given multiple treatments, again, we can see that detoxification and antioxidant supplementation improves the symptoms associated with autism spectrum disorder. A study conducted in the US on 78 children diagnosed with autism and 31 controls found that a low level of hair mercury from first cut hair was associated with a 2.5-fold increase in a later diagnosis of autism spectrum disorder. Levels of mercury exposure for the healthy controls and the autistic group was approximately the same. The study concluded that children with autism may have an inhibited ability to excrete the mercury they were exposed to. The study authors suggest this could be possibly due to increased antibiotic usage during pregnancy, which has been shown in animal studies to reduce mercury excretion. There could be multiple other factors causing this. As the number of diagnosed cases of autism spectrum disorder have risen so fast, it can be concluded that autism spectrum disorder is not a genetic condition. However, some studies show certain genes may be associated with a slight increased risk of being diagnosed with autism spectrum disorder. If autism could be caused by toxic metal exposure, ensuring ample levels of essential minerals during those periods of toxic exposures could reduce the potential damage those exposures cause and thus reduce the likelihood of the child developing autism. Toxic metals enter and are transported around the body by proteins designed to transport essential minerals. If there were a low supply of beneficial minerals in the body, increased absorption of toxic metals may occur. A study found that children of mothers who took multivitamins while pregnant, which also contained minerals, had a 65% lower chance of developing autism. The antioxidant effect of the vitamins may also play a part. If there is enough interest in these videos, I will continue to create more videos on similar topics. So if you are enjoying this video and would like to see more, please click subscribe and like. An older study conducted in the USA on 20 children diagnosed with autism found that all had abnormally high levels of D-glucaric acid. D-glucaric acid is a marker used to detect exposure to a wide range of toxic pollutants. Direct blood analysis found that all of the children had levels of toxic chemicals in their blood which were higher than the safe limits established for adults. Here again we see a direct association with environmental pollutants and a diagnosis of autism spectrum disorder. A study conducted in the USA on 278 children, which included healthy children and children diagnosed with autism spectrum disorder, found higher levels of a number of urinary porphyrins in the children diagnosed with autism spectrum disorder compared to the neurotypical children. Porphyrins are intermediate molecules used to produce the heme protein in the body. Various toxic metals can interfere with the process of heme production. This leads to elevated levels of porphyrins. Elevated porphyrin levels can be used as an indirect way to measure previous exposure to toxic metals. So here we see another indirect indicator demonstrating the link between environmental pollutants and autism spectrum disorder. Another study on 20 controls and 20 diagnosed with autism spectrum disorder conducted in the USA also found high levels of porphyrins, usually raised by mercury exposure in those diagnosed with autism spectrum disorder. A third study on 106 children diagnosed with autism and 12 healthy controls found the same pattern as described in the previous two studies. That is, those with autism spectrum disorder had elevated levels of certain porphyrins. However, in this study, a group of the autistic spectrum disorder patients were given 5 treatments with a metal chelating drug called DMSA. The treatment reduced the levels of porphyrins to levels almost the same as levels found in the healthy controls. This shows us that the increased porphyrin levels seen in children diagnosed with autism spectrum disorder could largely be caused by an increased body load of environmental pollutants, and that detoxification reverses this biomarker in autism spectrum disorder patients. A common biomarker found in those diagnosed with autism spectrum disorder is inhibition of the methylation cycle. The process of methylation is needed to create a vast range of molecules required by the body, such as antioxidants, vitamins, DNA, neurotransmitters, and ATP. The inhibition of this process has wide-ranging damaging effects. A review of the scientific literature conducted in Italy found that exposure to a range of toxic metals interfered with this process. So presumably, like other markers, this marker may be improved with detoxification treatments. A review of the scientific literature conducted in China relating to the association of toxic metal exposure and autism found a clear link between high levels of various toxic metals in those diagnosed with autism. A secondary meta-analysis conducted in Serbia, which reviewed 38 studies, found that higher lead levels have been found consistently in those diagnosed with autism spectrum disorder, and that exposure to lead is associated with an increased risk of an autism spectrum disorder diagnosis. A study conducted on 28 children diagnosed with autism spectrum disorder and 32 healthy controls found that those diagnosed with autism spectrum disorder had significantly elevated levels of cadmium and arsenic compared to controls. But more interesting was that the mRNA expression levels of a metal binding protein called metallothionein was drastically increased in blood cells of those diagnosed with autism spectrum disorder. Metallothionein is used to transport, store, and detoxify a range of metals and is strongly induced by exposure to toxic metals. By binding to toxic metals, metallothionein helps to protect the cells from being damaged by these toxic metals. So again, in those diagnosed with autism spectrum disorder, we see the presence of yet another marker known to be disturbed by exposure to environmental pollutants. Here is a summary of the treatments used in the studies mentioned and similar studies reviewed for this video. 1. Methyl B12 injections, 25 micrograms a kilo twice a week, plus 1000 milligrams of TMG, trimethylglycine betaine, and 800 micrograms of folate twice a day. 2. Vitamin E, 400 milligrams plus 5 to 10 milligrams zinc, plus 50 to 100 milligrams of vitamin C. 3. DMSA, 10 milligrams a kilo or more in other studies. 4. Syndion multivitamin mineral antioxidant supplement. 5. IV DMPS plus EDTA with oral DMSA, dosage was not specified. 6. 400 to 600 milligrams of NAC per day. As you have seen, those diagnosed with autism are likely to have increased levels of toxic metals measured in their tissues, blood, and urine. Exposure to toxic metals causes a disturbance of a number of biological markers. We see the same pattern of disturbances in those diagnosed with autism spectrum disorder. We have seen that when metal chelators are given to autism spectrum disorder patients, they are likely to excrete high levels of toxic metals compared to healthy controls. Most importantly, we have seen that treatment to lower levels of toxic metals improves behavior, physical symptoms, and the biomarkers in those diagnosed with autism. These environmental pollutants affect us all. Research has found that mercury levels in tuna caught near Hawaii is increasing at a rate of 3.7% per year. Burning of coal releases thousands of tons of toxic metals into the atmosphere every year. It is impossible to avoid being exposed to a wide range of toxic substances. Many of these pollutants, like thallium, cadmium, mercury, lead, PCBs, and dioxins, get trapped in the body for years or decades. Small ongoing exposures can lead to a continual accumulation of pollutants in the body. Thankfully, there has been a substantial amount of research conducted on how we can use plants, vitamins, minerals, pharmaceuticals, and herbs to hasten the process of removing these long-lasting pollutants from the body. I have put together a guide which was based on over 1,000 research studies, which guides you through the various methods available to lower your toxic burden of environmental pollutants. The book itself contains over 50 pages of references to scientific literature discussed in the guide. Most of these studies mentioned previously in this video use crude chelation protocols designed for acute toxic exposures. Such protocols are rather likely to cause side effects and potentially a temporary worsening of symptoms. In one of the studies, there was a fairly large dropout rate. The pharmaceutical chelators used are unable to enter the cells to remove cellular buildup of toxic metals. These kinds of drugs are quite ineffective by themselves for treating toxic exposures that happened months or years ago. So if using such drugs, it is much more effective to couple them with other molecules which are able to upregulate or facilitate the cellular detoxification process. To efficiently detoxify, it is far more effective and safe to use a combination of minerals, vitamins, herbs, and pharmaceutical chelators. My guidebook explains how you can use these together and the scientific basis for such combinations. Detoxification involves transporting highly toxic substances around the body, some which will inevitably be redistributed. So this process needs to be conducted with extreme caution and should not be rushed. Rushing the process could drastically worsen existing symptoms and result in those who need it most giving up. My guide is suitable for use with children or adults. Click the link below to get the guide. I wrote the guide after recovering from chronic fatigue syndrome. I visited many conventional and alternative doctors without a solution. So I researched and trialed various detoxification methods. I used these methods discussed in my book to completely recover from chronic fatigue syndrome and a range of other symptoms. This book is not only for those suffering health challenges, it is for everyone, as we all have some level of persistent buildup of highly toxic pollutants in our body. If we do not reduce the levels of these pollutants, we simply cannot achieve optimal levels of health, energy, vitality, and vigor. Click the link below to get the guidebook. Thank you.